Cognitive therapy was first developed by Albert Ellison in the 1950s. Ellis concluded that cognition, emotions, and behaviors are integrated and holistic. Ellis's theories became the therapeutic approach of rational emotive behavior therapy, or REBT. Aaron Beck developed and implemented CBT in the 1960s on the idea that depressed patients generally had patterns of negative and self-crucial thinking. The cognitive model put forth by Beck assumes that a person's experiences are active processes that result in cognitions or thoughts. These cognitions are intimately linked with schemas, or the way in which the patient appraises or interprets his or her environment. The goal of CBT is to identify the negative patterns of thought that lead to negative emotions and replace these negative patterns with rational thought.
REBT began as RET and became REBT in 1993. The fundamentals of REBT are that all people are born with self-defeating tendencies. Also, the past is not crucial in a person's life. The past affects him a good deal, but he affects himself much more than the past affects him. Usually a sane thought, such as "I dislike my own behavior," is followed by an insane one, such as "Because I don't like my behavior, I am no good." REBT often ends in a homework assignment where the patient is asked to use the technique they have just learned. It sticks mostly in the present instead of the past, and REBT follows the ABCDE model. A is the activating event. It is often not controlled, such as a person you know passing you on the street without saying hello. B are your internal beliefs of the event. C are the consequences of your beliefs about the events. This can be emotions, behaviors, or thoughts, such as feeling depressed or avoiding people or situations. D and E usually take place during therapy. D is to dispute or challenge your unreasonable expectations, and E is an effective outlook developed by disputing or challenging negative belief systems. Can you identify the A, B, and C in the following video clip?
What's the matter, Janelle?
I got a C on my math test.
Well, that's not too bad.
Yes, it is. I'm never going to go to college. I'm so sad.
The goal of cognitive therapy is to identify distorted beliefs and, by changing these beliefs, alter an individual's behavior and ultimately their emotions. Through the therapeutic process, we uncover various cognitive levels. Automatic thoughts occur at the most superficial level and are rapid, involuntary, and linked to specific emotional reactions. The next level, assumptions and rules, bridge the gap between core beliefs and automatic thoughts. They often take the form of if-then and should statements. Core beliefs, or schemas, are the fundamental level of how we view ourselves, others, and the rest of the world. An example of a negative core belief is, "I am no good." As we proceed through the exercise, try to identify the various levels.
Scenario 1. Brian lost his job as a manager at Pep Boys and was forced to move in with his parents. He currently is employed at Subway as a sandwich artist. Brian came to therapy stating that his friends were telling him that he seemed really down lately. He also disclosed that he feels unfulfilled and unhappy at work. First session, technique sentence completion.
Okay, Brian, how are you feeling today?
I don't feel happy anymore.
Okay, maybe you can help me understand by completing this sentence. You don't feel happy anymore because you think...
I don't feel happy anymore because I think my life isn't going anywhere. I can't get a job anywhere. I don't know, I just don't know what to do. God, I feel like such a loser.
Well, okay, that's something we can work on.
Okay.
Technique, challenging the quality of evidence.
Okay, Brian, so to you, what would you say a good job is?
I don't know, high pay, good benefits, nice fancy big office. Something with a title. Make me feel like I'm somebody.
Mm-hmm. So would you say that people who don't have high pay, good benefits, and big title, are they all losers?
Well, I guess not everybody.
Technique, imagery.
And it's not that. Okay, woman. I can't pick up no female from the club. I don't know what to say or what to do. They just reject me.
Okay, so what do you think women likes?
They're probably looking for a dude who's confident, caring, probably funny.
So let's say you went in there with this confidence, acting confidently in the manner you just described. Do you think that could work?
It could work.
Technique, creating a problem list. Brian feels hopeless, can't meet women, and wants a better job.
Okay, so to better understand and visualize our problem here, do you want to come up and prioritize this list?
Okay.
Technique, creating a goal list.
Now, what I like to do is make some goals that will help us address these issues.
Well, I like a better job.
Technique, forming concrete goals.
Okay, that's a pretty general goal. Can you make it more specific? What actions can we take in the short term that can address
Well, I can get some applications, maybe make a resume.
it? Okay, that sounds good.
Technique, assigning homework.
Okay, so for homework, what I would suggest you to do is every time you have a negative thought, you write it down in a journal.
Aye.
Technique, cost benefit and percentage analysis.
Okay, so let's list some pros and cons. The disadvantage could be that you might get rejected or it's a hassle. But the advantage is that you will get a job and you get a higher pay raise. So if we were to give each a percentage, how would you rate the cost versus the benefits?
Well, I don't really keep track of numbers like that unless I'm playing blackjack, but something like 60-40, 70-30.
Okay. So what do you think of the situation now?
Well, I guess it's not all that bad.
Technique, challenging the schema.
I just feel so worthless. I make mistakes all the time. I don't do things right. I don't know how I can waste someone else's time.
So do you think, are there people out there who makes mistakes who are still worth something?
Everybody makes mistakes.
Right, everyone makes mistakes. So do you think you can make mistakes but still feel you're worth something too?
I guess I never really thought about it that way.